This program is a paid commercial announcement and in no way represents the views of WPHT or its management.
Talk Radio 1210 WPHT, WPHT HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and welcome to a full show.
So we hope, John.
So we hope, right? If you listened last week, we had an abbreviated version due to power outages, but we're here and a full show. Good to have you with us as always. Health Watch every Sunday, 8 till 9. Talk Radio 1210 WPHT. The clue is in the title, as we always like to say. It's about health, and it's about your health and your families, and about how Dr. Molly can help you as far as your overall health picture is concerned. Dr. Molly Fantasia, the PhD doctor, executive director, and founder of Innovative Medical Associates, Marlton, New Jersey, will do the who, what, when, where, why, and how of Innovative Medical and how they can help you potentially. And, of course, we always welcome your calls at 855-839-1210, 855-839-1210. It's Health Watch every Sunday, 8 till 9, Talk Radio 1210 WPHT. What you attempt to do, Dr. Molly, is prevent power outages for people. Right?
I try, but this week was terrible, John, with the tornadoes going through.
Yeah, it was
I
tough.
tried to make sure that any of my patients who I thought might be affected, I called over the weekend to just check in on them, because there's nothing worse than having some kind of, I would say, disaster hit you as well, along when you have some challenges already with your health.
So what is it that you do, Dr. Molly? Because I always...
I'm not. Well, people are not sure.
Yeah, they're not sure. They say, well, what are you doing? I said, well, Tuesday and Thursday, I just say, I simplify it, vitamin C treatments.
Well, I know you do.
What is that? I said, well, vitamin C treatments. But what do they do? What do they put in? I said, well, you have to ask Dr. Molly.
Well, bottom line is this, John. We are a licensed primary care facility. So we can do anything that we would do at your regular doctor's office. You need a prescription, we can let you leave with one. But, it's the philosophy of our entire clinic that really resonates with me. We would like to have you have a quality of life and not necessarily use a tremendous amount of pharmaceuticals. Now, I'm not saying throw your pharmaceutical away. You have a cold, you have a virus, you have an infection. Docs are going to prescribe product for that, meaning they're going to prescribe the basic pharmaceuticals for that. But our real mission is to maintain your health in such a way that we can use the least amount of the pharmaceutical necessary to help you and solve the medical issue.
When you're talking about what you do,
basically
the pharmaceutical or the nutraceuticals and the substances that you use kind of take the place of prescription
or
meds.
Can augment.
Or can augment.
They
right.
can
One or the
work
other.
with it.
Right.
And that's really the idea of what we do. So we use hydration to deliver those natural substances. And again, I'm going to talk about substances that you could get in a good health food store. I have a health food store proprietor, and this gentleman is very, very knowledgeable about what substances that he sells and what substances he uses. And I would say that you can have that in a health food store. You can go in there and go to the aisle and pick it out or whatever, maybe get some good advice, but sometimes you may not. So the idea is to utilize your nutraceuticals with some help, and that's where I think we come in. And also to utilize them in an appropriate therapeutic level. And that's really the key. We find hydration does that.
And when you talked about therapeutic level,
Yeah.
That's something that people think they can get in a health food store.
Yeah, and
not
sometimes,
really, right?
like the gentleman we have right now, knowledgeable health store proprietors who have a background, let's say, in nutritional medicine, might be able to help you. And this gentleman happens to be one of them, but there are a whole lot out there that are not.
And the therapeutic level was really my point. That is delivered via hydration.
Yes.
And you really can't deliver it with
Not
vitamin C
necessarily.
pills.
Not necessarily. It's like putting a drop in the ocean, a drop of water in the ocean. But what can happen is, of course, we are going to help you look for brands that might work for you at home along with what we're giving you in your bag. That's really the key. And you want knowledgeable people to help you with that.
When you're talking about the hydration and
Yes.
when you're talking about innovative medical, and people come in and let's say they say to you, Dr. Molly, I'd like to start. Well, what do they start with? One treatment a week, 2, 3? How does
It's
it
going to
work?
depend on what they're coming for, the underlying treatment. Like today, we're going to talk a little bit about more severe types of conditions. But honestly, it really depends. If people have a small challenge, well, it might be once a week, and you may be good with 10 treatments. But generally, it takes time for the nutraceutical to really reach a level that will help you, and you need to make sure that the extracts that a facility is using, and our facility only uses extracts of God's ingredients, period. And what we look at is just what it is that you need uniquely. And that's the bottom line. We're very unique. We do not have one size fits all.
Well, I can attest to that because I was going to say I've been coming for 20 years and people have asked you, does he ever get better?
Well,
and it's not really about that.
Well, you know
right?
what? Better. Here's the thing. As we progress in our life, John,
Yeah.
we become sort of exposed to many other challenges. Look, you and I are not the same people we were at 20.
That is
Come on.
true.
Come on. And I don't think we're unique in that. What happens is we age along the line, and thank God, and we want to age till at least 120, right?
Exactly.
So there are
I'll
changes.
sign up for that,
Yeah,
yeah.
me too. And there are changes that happen physiologically that we try to keep at bay.
And I was thinking about that because you were saying once or twice a week, and then sometimes people stop and
Of course.
and they feel it.
Oh, yeah.
And we're going to talk later about a patient who said to you, I stopped and I felt it,
Yes.
so I came back.
Right.
So, I've been coming for 20 years because there's been multiple challenges.
Well, you had a few
but-
there.
right, and you right, and you maintain. In other words, I missed one last week and the week before, and I feel it. I
Yeah.
do actually feel it.
I know that.
so-
I know that. It's hard to believe, but it's true. And look, I'm not out to hoodwink anybody. Bottom line is, my patients come back and tell me. That's
Yes.
the facts.
Right.
And I really feel proud of that because my entire staff is behind the protocols that we've put together.
Typically here on the show, even, we get calls and people will say to you, Dr. Molly, I have this following condition, and they'll explain it. Can you help me? And I guess the question is, you have over 600 protocols.
Right, roughly,
And
that's
so you can most likely have something to help
And-
many conditions.
Right. And here's the thing. The protocols, although most protocols are set in stone, mine are not. They're fluctuating. They fluctuate depending on where a patient is in their own treatment modality. I mean, traditionally, what they're getting. And also, it changes if I'm trying to hit a couple of particular issues that a patient is having right now. So there's transitional types of protocols. And that's the beauty about what we do. And I got to tell you, the other thing is, there isn't a week that goes by that I don't review every one of each individual patient and say, oh, this is something now that's coming up and I can make it better.
And I know you've said that because I've noticed sometimes after a few of my treatments, I feel a little differently.
That's right.
And I ask you, did you do? Yeah, I changed this. I did that.
Right, based on the information you gave my nurses
Right.
during that week.
Right.
And that's really important. And it's important for me to maintain dialogue with my doctors, with my physicians, and I do.
All right, 855-839-1210 is our number here. If you got questions for Dr. Molly, we're talking about basically, we call this the overview of what Innovative Medical Associates does. And if you do have a question, it's always a good time to call early because every week we get to the end of the show, we try to squeeze in a call with 1 minute left. So we are uncomfortable doing that because we want to make sure everybody gets their questions answered. 855-839-1210. What's I guess, and we're going to talk about cancer and your
Of
cancer
course.
support later on in the show, but what's like the number one condition that you treat that you seem to have the most success with?
Well, I would say that the number one type of challenge that my physicians treat are really autoimmune in nature. Exposures. Since COVID, I have to tell you, everybody is worried about this new surge in COVID. And I would say, look, to my patients, let's maintain our antioxidant level. Let's maintain what we need to be safe from COVID, the best of our ability. And so I would say right now, everybody's worried about exposures. They're worried about being exposed to COVID. They're worrying about this new strain of viruses, in which, by the way, if you think about it, all through life, these viruses change, they mutate. So the idea is let's keep our own immune system as healthy as possible. So that's something we're seeing right now.
And it's interesting. You were talking about the immune system and the Delta variant. People were asking me this week, well, did you get? Well, I'm fully vaccinated, but I said,
and I say that.
I said I never worried about the COVID because the immune system was so good, and I always feel like the immune system is strong. Thanks
God.
to you.
Thank God.
Thanks
thank the man upstairs.
And also that it protects me from COVID and the Delta variant and all of that stuff. I always felt that.
Well, I think the most important thing that we have to do is keep the person and the patient's immune system tuned up and make sure that their levels, their antioxidant levels, their white blood cell counts are where they need to be to fight off infection. And I think that actually I've always been a subscriber to that, whether we had COVID or not, honestly. And I just think this is in keeping with that kind of philosophy.
All right, we have plenty more to talk about here on the show. Coming up on our first break of the morning, our show is Health Watch every Sunday, 8 till 9, Talk Radio 1210 WPHT. 855-839-1210 is our number here. If you have a question for Dr. Molly, you have a medical challenge you want to run by her, or just a simple question, 855-839-1210. Coming up, we're going to talk about a very interesting story about a patient who came from out of town, and also information on Dr. Molly's new book. Oh, boy. It's all right here.
It's finally out.
That's right. It's all right here. Health Watch, Sundays 8 till 9, Talk Radio 1210 WPHT with Dr. Molly Fantasia. I'm your host, John DeMasi. We return. More today's Health Watch after these words. Welcome back to Health Watch. We're going to do a show one day on what we talk about during the breaks.
Oh, it's great.
Yeah. Welcome back. Operator standing by right now at Innovative Medical, 856-489-0505. That's the number for Innovative Medical Associates, Marlton, New Jersey. You call the operators right now, and if you want to get more information, but most importantly, you want to sit down with Dr. Molly and make an appointment to kind of discuss your particular medical challenge or your problem, then that's what you do. You call and make that appointment, 856-489-0505, 856-489-0505, and the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And also want to remind you, Dr. Molly has just put out her new book, God's Ingredients 2, T-O-O.
Right.
And it is available now on Amazon and Kindle and all that stuff. So what's in the book?
Well, actually, I have a compilation of patient stories showing, patients who've come to me with various challenges and how it impeded their quality of life and what we were able to help them with. And more importantly, I believe, I totally believe that natural substances, the substances that God has given us, that has graced us with, has a lot of potential to help people through whatever medical challenges they have and at least keep their immune system tuned up so that it readily accepts some of the traditional type of pharmaceuticals that are necessary to maintain their health. And John, I think that's one of the reasons why I'm so upset about this new variant, because it's really not a new thing to us in science.
Right.
We know viruses mutate, and that's why, for example, you change the flu shot every year. right? Or you get a booster for your kid's measles shot. These kinds of things. It's not new data. That's not new data. What's new is how we're handling all of this, John.
Yeah,
it's amazing.
Which is always questionable.
Oh, my goodness.
All right, 855-839-1210 is our number here in the studio. Questions for Dr. Molly, medical challenges you want to run by her, or anything in general, 855-839-1210. I know you wanted to talk about this, and this is an interesting scenario where you had a cancer patient
come in. Not my patient. She wasn't my patient.
She wasn't your patient.
She came in for a free consult.
For the consult, and she came in from out of town. And she had gone to Mexico, and I know this. Can you kind of walk us through this story?
There are many alternative clinics in Mexico and in Germany and in Europe and all these places. They're highly expensive. They're highly expensive. I mean, you don't go there for probably under $15,000-$20,000 for a course of treatment. Maybe it's a week, maybe it's 3 weeks. Actually, it's going to depend on what you have. People all know about several of the celebrities that have all gone and done this, right? Okay. The bottom line is this. She comes back. Now, she is local. She was local. Okay. She comes back and she's been, quote unquote, shopping for price. Now, how she got to me, I'm not sure. Because, John, I like to say, if you get to me, you're shopping for quality, okay?
Well, you should be.
That's right. I mean, I was blown away by that very first statement. I am purely shopping for price. So I said, well, what do you think it is that you want from me? Because generally when people come in for the consult, I want to extract from them, what's the condition? What are they looking to do? How is their quality of life impeded right now or in the future? And then I can put a program together. But this gal was very adamant. She had bought some type of medical device for $25,000 or $30,000, and she was doing this and she was doing that. And she said, what I want from you is pure vitamin C. Well, I was taken back, and I said, well, I think what you need to do is speak with my lovely Linda right now and get a feeling for what it is. I said, I don't just throw vitamin C at you. I'm going to think about the extract. I want to know a little more about your cancer. I want to know where you are in your cancer journey right now, and who are you being treated with. Well, I handle my own. Okay. All right. I have patients like that. I have a wonderful patient, Pam. She's handled her cancer for the last, how many years, John?
Yeah,
okay, several. All right.
Exactly.
That's fine with me. But the other side of the coin is I'd like to know, I don't normally have a patient who comes into me and tells me exactly what they want. That's it. So therefore, I should come down in price. John, I am the best kept secret in Marlton and furthermore in Cherry Hill. You know that.
And South Jersey. I mean,
absolutely.
If you want to throw in all of South Jersey.
Absolutely. I'm pretty well known other areas at this point.
Yes.
But I am not about price. I am not about price because I'm about quality.
I think what got me about this story, and you were telling me before the show, is that somebody comes in and tells you about the protocol, about what they need or what they should get. And you're the expert, not them.
She's looking for, she said, don't waste my time if you're not going to give me 50 grams of vitamin C. I laughed at her. Because when we start a patient on vitamin C, we'll start them probably near 70,000. So the units of vitamin C. So the bottom line is she's off base completely.
All right, let's go to the phones. John's in Marlton. John, good morning. Welcome to Health Watch.
Hey, John.
Good morning, Dr. Molly. Good morning,
hey, it's
John.
my pal, John. Hey,
right.
John.
I gotta tell you something. I came into your office yesterday or Wednesday.
Yeah.
And I said, Doc, I've been 6 weeks now, 8 weeks, whatever. I've been hacking and coughing. It's getting worse and this and that. You said, well, I'm going to give you something else you're going to add to it. So we're talking, and somebody brings up about aloe vera.
Yeah.
So I don't think nothing about it. And I said to Linda, I said, I just stopped taking that for a while now. So about 2 minutes later, here comes Linda with a big glass of aloe vera, and then here you are behind her. And I drink the aloe vera, and you say, John, how long have you been off of this and the vinegar? I said, about 6 to 8 weeks. And then it struck me, you dummy, this is what's going on. And I'm taking it for 5 days now, and I'm feeling better.
I hear it. I hear it.
I'm
and
feeling
again,
better. I can't believe it.
Well, listen,
My point being is, and I never thought about it.
I understand.
What you give in the bag is in conjunction with what I take at home to complement it.
That's exactly
And I never
right.
ever thought about. I thought she was going to beat me, John. I swear to
No,
God.
no, I didn't come out like that, John. First of all,
No. I'm
listen.
only teasing.
Yeah, I know. Listen, I don't come out like that. And the other thing is, it's a specific type of aloe that I like people to be on.
Right,
because
right.
aloe vera runs the gamut, and I really don't want that. I want you to use a particular type of clear
That's the
aloe.
one I take, yeah.
Right, exactly. And Barbara was like, when Barbara got in, she goes, "Oh my God, John, stop!" Oh, I said, "Yeah, Barbara." She goes, "Oh, I hope he didn't stop the rest of the stuff I put him on." I said, "I doubt it, my friend."
No, I didn't.
Yeah.
I just
Thank
stopped those two because I thought.
know.
I'm getting
Yeah.
better.
That's
oh,
right.
My
That's
gosh.
right.
Well,
You
anyway,
know,
I had to.
thank
I had
you.
to call and
God
let you know
bless
that
you.
what you
God
were
bless you.
saying is exactly true,
God
in
bless
the
you,
sense,
John.
you're great
Thank
to
you.
me, Doc.
Thank you, and
I
I
wish
always
you guys
will.
the best.
And I'll tell you something, John. I appreciate your family. They called. You have a daughter-in-law who has a little challenge, and your granddaughter, who I'm extremely concerned about.
Yeah,
I
well,
want
she's got two more tests. She's got
Right.
she's going to do the scope up
Good.
and down.
Good,
And
good.
then she's going to some specialist. I don't know who she's going. Somebody
Yes.
you recommended, I guess.
Yes, and I'm glad.
She's going to them, but they can't find anything, Doc.
It's okay. We're going to take care of it. But the most important
know.
thing is that you notice again. What we do is we're going to send you for conventional as well. This is what we do. We're not just going to say, "Oh, well, we're going to wave the magic wand. She's going to be okay." No. We want to make sure that there are other items that we check off the list and make sure she's A-okay. God bless you, John.
All right, John, thanks
Take
a lot
care.
for the call.
By the way, he's a young guy, John.
Yeah. Proving once again, what did he just stop the aloe vera?
Yes, he stopped the aloe juice.
But I mean, and he's been a
A long time.
long-standing patient.
Yeah, but that's what happens. It's just like
I feel good. I'm going to stop it.
No, not only that, we do this with conventional medicine, right? The guy gives you a steroid pack, which I'm not a fond of, okay? But right now, one gal in my office, Fran, fabulous Fran, has a back problem. We sent her for the MRI, or our doctor sent her for the MRI. We see there's two bulging problems, right? So the first thing you do, you put them on a steroid pack. She says to me, I don't feel like taking the rest of this because I'm starting to feel better. I said, listen, you're starting to feel a little better based on the drips and this pack. You're not to stop it. So people do this with their regular meds too.
Yeah, I was just going to say, it's like, oh, I feel good. I don't need it
Yeah,
anymore,
right. Well, don't be smarter than your docs, okay?
Yeah, remember that it said finish the medicine. How many times did they put that on the
Well,
pharmaceutical labels?
and how many times do we stop them?
Right, exactly.
Okay, and I understand if you're having side effects from certain things, you got to go back and discuss it with the healthcare provider.
So John is a long-standing patient.
Yeah,
and-
he's young. He's very young to have a granddaughter at that age, but it's okay. All right, good.
So this issue of somebody telling you what they want, and you have often said take control of your health.
Right. I'm saying
But
let's
there's a line.
collaborate.
Yeah.
Let's collaborate. That's true in my office. What happens is my physicians, my healthcare providers, we collaborate. We don't arbitrarily say, "Oh, no, you don't need this." Listen, when you have cancer, how many times have I said, I have had patients who've done nothing but alternative medicine. And I've had patients who've done nothing but conventional medicine. And what happens is it's the combination that I see tends to have the longest longevity and certainly the better quality of life through the cancer process.
Okay, we are at the halfway point of the show, coming up on a break, which means you have plenty of time to call in if you have a question or a thought for Dr. Molly. 855-839-1210 is our number here in the studio, 855-839-1210. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. And I'm your host, John DeMasi. Coming back with plenty more of today's edition of Health Watch after these words. Back here on Health Watch, operators standing by right now at Innovative Medical Associates. And we always like to remind you that when we're on the air, they are there. And when we're not on the air, they are there, okay?
Yeah, we try to take, yeah.
I mean, they're there all day, all right?
Actually, Linda worked that yesterday again.
Yeah, I mean, you do have Saturday hours, and the operators work Sunday. Listen, it's a 7-day-a-week operation. 856-489-0505. That's the number. 856-489-0505. It's Innovative Medical Associates, Marlton, New Jersey. And people say, well, when I call, what do I ask? Well, ask any question you like, but really the best thing you can do is simply make an appointment to sit down with Dr. Molly. The initial consultation is complimentary, and that's where you ask all your questions. You get to visit the clinic, you look around and talk to some patients, and if it's a Tuesday or Thursday, I'm there, you talk to me. So it's like, what take your pick, all right? 856-489-0505, and the website, innovativemedicalassociates.com. InnovativeMedicalAssociates.com is the website. Check it out. A lot of good information on that as well. And don't forget, we have our Health Watch replay. If you miss any of today's show, we are replayed on Sunday afternoon between 4 and 5. 4 and 5 every Sunday. It's Health Watch replay right here on Talk Radio 1210 WPHT. It's Health Watch, of course, every Sunday, 8 till 9. Let's go to the phones. Pat is in Conshohocken. Pat, good morning. You're on with Dr. Molly.
Hey, Pat, how are you?
Oh, fine. Good morning.
Good morning.
I wanted to ask if you had any protocol for ulcerative colitis. I have a relative who...
Yes. Absolutely.
You mentioned aloe vera and a special kind. I know they sell it by the gallons at Walmart, but is that the right kind or not?
Well, I can't exactly tell you that on the air. I would love to, but I don't want to get in trouble with all of the aloe vera group out there that makes theirs, okay? But if you come in at some point for the consult, I'll happily tell you. But there's even more than this. It's so funny you bring this up. We have a nutritional protocol that we absolutely believe in. Most people with the ulcerative colitis have some bad pain. They can't eat as well. Many times they're underweight or they're certainly losing weight over it. And of course, you got to be worrying about your blood count because if you have bleeding and all of these things, right? Hopefully you're under the care of a good GI doctor, right? I hope you are at this point, yes?
Are you, Pat?
I'm not sure about the facts because it is my granddaughter.
Okay.
Oh, okay.
Oh, okay. Good. All right. Well, the bottom line is, yes, I also use a subclinical dose of a particular type of regular medication. It's an off-label use. My doctors and I have done it extensively, and I will be happy to talk to your granddaughter about doing this, but I would like to do it in the consult so I see them. What's interesting is one of the very well-known physicians in Philadelphia in the GI situation, he just saw a patient of mine who was doing extremely well, and he said, I have a new medication that can help you. And what do you think the big pharma's done? They've taken part of our protocol, which is natural in substance, and also put it in with a steroid, and they've now wrapped it all up and put a patent on the whole thing, and I'm going to tell you, it's about 5 times the cost for the particular the subclinical dose of the particular medication that we're using. The pharmacy that I've been having this compounded from, and I use a very particular type in a very particular way, has put it in, said, guess what, Dr. Molly? Now, Big Pharma's going to make the powder go up substantially. So you see what happens here is our friends in Big Pharma don't want us to use certain things in subclinical dosing. They want to make sure they put a patent on the natural stuff by putting a tail on it or combining it with something else. And I can tell you that it's really a problem. But yes, I have a protocol, and yes, I would be happy to speak to your granddaughter.
Okay. Now, one question: does it have to be managed or can it be cured?
Well, I think it has to be managed. We only manage quality of life. What we're looking for is making sure that people stay healthy. Now, I have a young man who's been with me for many years. He started out in a traditional program with with a traditional physician who's a GI guy, and he started out in a hospital system. And I can tell you that he's young. He just had his second child, and when he came to us, he was a mess. He was a mess. I happened to go to school with his dad, so it was a very interesting consult. But please have your granddaughter call. I think we can improve her quality of life. Thanks.
Pat, thank you for the
very
call.
much.
Thank you for the call. Good
And
luck with that.
Isn't that a great question?
Yeah.
So I hope
Well-
I answered that.
Well, that goes back to what I said to you earlier. I said people call the show and they call you in the office and they say, Dr. Molly, do you have any protocols for, and
Yeah,
fill in the
we
blank.
do.
And
We
here,
do.
here we go.
Here we do.
Yeah.
But you know what's interesting is what Big Pharma is trying to do.
Yeah. Well, they
So
don't want to lose
forget.
any money. That's
You
know.
better believe
Right.
it. You better believe it.
Okay. 855-839-1210 is our number here in the studio if you have a question or a thought for Dr. Molly. So we were talking before the last break about cancer
Yeah.
and about a patient who had been to Mexico.
Right,
But wanted to
wherever.
kind of finish
And
that.
so I want to finish this by saying, look, she's talking about shopping around for a particular dose of vitamin C that I believe is a drop in a bucket for the cancer patients, assuming that vitamin C is appropriate for them. Remember, depending on what we're doing, we look at the extracts of vitamin C as well. Because if you are getting chemo, if you're getting radiation, your body is creating free radicals to go after those cancer cells. So whoever you go to for your integrative care better be aware of how to use vitamin C as a pro-oxidant this time, not in the antioxidant thing to clean that up, because now you're defeating the purpose of the chemo. So I have patients who are on chemo. I have patients who are in immune therapies, and they're doing very well. Are we curing cancer? Heck no, we're not curing cancer, but we are doing a good job to keep people healthy through their cancer protocols, their traditional cancer protocols. And as a result, that healthy translates into a whole lot of better quality and making life worth living again.
Because a lot of times people do come to you, and I've seen it, where, I mean, they're in bad shape.
Absolutely.
And they've been to many places, and they haven't had
may
any
not
help.
make it through the chemo.
Right.
And the whole point of what we want to do is we want to do this. And you know, I have a consulting oncologist who's out of New York area, and when I run into an issue or something, I dial him up and we talk on the phone, and we also can bring the patient in and have a consult with the patient. And that is the way I believe we should do this. But for the most part, again, I have patients who absolutely refuse conventional treatment and those who do conventional plus what we do, and they tend to do better.
All right, 855-839-1210 is our number here if you have a question for Dr. Molly. 855-839-1210. You had a group of women come in to see you from Florida.
There you go. Yes.
And again, you have them come from all over.
I do.
right?
I do. For various
Ohio,
things.
Indiana,
Yeah,
Florida.
I have them from all over. One
right.
of them is a caregiver. She is an expert in essential oils. But the bottom line is this. All three of these women have different types of cancer. So their protocols are individually put together. But what else we were able to do is, in one case, I was able to get them to a particular surgeon who was able to do what the patient wanted for the breast cancer, because she did not want to have a radical mastectomy that the physicians in Florida want to give her. Guess what? She came here. We put her in touch with a wonderful surgeon who's very cognizant of people's wishes and able to do what she wanted to do. And as a result, right now, we are handling her case, and she goes back and forth to Florida, and she sees the surgeon intermittently, and she's doing pretty well. In another case, we were able to send one of these people out for a PET scan who hasn't had a PET scan since she was with us in 2015. Now, all this time, she's being managed in Florida, and they never, ever used a PET scan again.
No one said... No. Oh, okay.
How crazy is that? Okay?
Yeah.
So we were able to do that. The third case is also a patient who came here whose physician told her, well, you know, if you don't do what I say, you're going to expire. Use that word, expire, which I hate. It sounds like we're throwing out canned food. Expire in 3 months. I don't believe that. First of all, I believe that God is the one who tells us when it's our time
That's
to
right.
pass.
That's
okay?
right.
Number one. Number two, his job, in my mind, is to do everything he can to arrest the cancer from going forward. but also to help the patient enjoy some quality of life. Well, I'm hoping that we are doing this right now. They're at another patient. They're with a priest patient who's doing a mass right now in somewhere here in New Jersey.
Okay.
But my point is, these people are doing fairly well.
And will continue to do well.
I hope.
Yeah,
That's our
okay.
job.
But how, I mean, when somebody says, "Oh, you can," a doctor told my mother that.
I
years
remember
ago.
that.
Yeah,
I
yeah.
remember how horrible that was.
Yeah, like I said, sounds like you're getting ready to leave this earth.
He said it like
He
that?
said it like that, yeah.
Well, yeah, well, I think that's a little better than expired.
Exactly.
But
yeah.
I will tell you, and I've had cases like that. I had a case of a patient. They told me the young man, he was in my first book. When I called the doctor to stop sending the pain medication because my physician said that's killing him, get that
Which it
stopped,
was.
which it was.
Right.
And guess what? He said, "Oh, did the patient expire?" I said, "No, the patient's living and going to law school. He's now a lawyer." Okay, but the point is, these kinds of things are very upsetting. Healthcare should be about total care. You should help a patient emotionally if you can.
Okay, we are coming up on our final break of the morning, and then we're going to talk to. It looks like we're going to talk to Helen in Royersford. We'll do that after the break. It's Health Watch Sundays 8 till 9. Talk Radio 1210 WPHT 855-839-1210. Our number here in the studio 855-839-1210. With Dr. Molly Fantasia, the PhD doctor and the executive director and the founder of Innovative Medical Associates. I'm your host, John DeMasi. More Health Watch after these words. Back here on Health Watch, and operators are standing by right now at Innovative Medical Associates. And when we leave you at 9 o'clock, that doesn't mean they go home. I mean, we do, but they don't. All right? That's how it works. Operators are standing by right now at 856-489-0505. That's the number for Innovative Medical Associates. You can call now, you can call after 9, or you can call during the week, 856-489-0505. I suggest you write that down, because if you don't, then later on you say, hey, I want to call that number. What is it? 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Our show is Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. Let's go to the phones. Helen is in Royersford, PA. Helen, good morning. You're on with Dr. Molly.
Good morning, Helen.
Good morning, Dr. Molly.
Hey.
My question, I hope, is an easy one. How can you boost your immune system?
How can you boost your immune system? Oh, my goodness. First of all, you want to make sure you're taking the right type of vitamins. You want them bioavailable. There are so many brands out there, right, that it's really hard for most people to look through them and decide what to do. One of the things we do at our place is really try to help people take their oral vitamins and do it in a way that works. And the other thing is, there are certain vitamins that really work cohesively together. So you want to make sure you have those. In addition, I would say a course of vitamin C therapy wouldn't hurt anybody. And in many ways it helps. It certainly can help us through this. And I would say you want to eat well. Obviously, organic as much as you can without breaking the bank. I get that. Believe me. Right? I get that. It's really hard. It's hard also to know. But I am a firm believer that God gives us an innate ability to really utilize his garden in the best way possible. So, of course, we want that. You want to exercise a little without killing yourself. I have a lot of young men who come in who are athletes, and they want to just be, they want to work out till they work themselves into a frenzy. I think there's a balance. And I think ultimately it's a balance in life. If you have to take a medication for a particular condition, I say you take it. But of course, we would like you to take the least amount possible to correct the medical challenge. And I think the other thing is we need to have good microbes in our gut, because our gut and our brain work together. And that means taking a series of things like probiotics, and a good one at that. And also maybe a series of taking some enzymes with your meal. So I think balance is really the key. That's the key, my dear. I do.
What is a good probiotic?
Well, I can't really recommend something over the air, but if you come in, see me, I certainly will do that. Here's the thing. There are many brands out there. The thing I don't want my patients to do, or our patients in our facility to do, is to waste their money on nutraceuticals that don't really help them. Now, I actually, as I say, I'm treating a young man, and I want to call him young, although he has grown children. He's had a health food store, I think, for 30 years. He's excellent at picking these things out. Now, I might be able to send you over to him, and he's not that far from you, actually. So, yeah, I think that there are many ways to do this and many types of nutraceuticals that will help you. But again, I think it's all about the balance. So God bless you in your journey, and you're right. Keep your immune system up.
Helen,
Thank
good
you.
call.
God bless
Thank you, and good luck with that.
Thank you. Simple.
You know, that's
not really
simple, but
not really simple, but it's true.
But I said about the immune system before that I
Right.
always felt as though what you were doing with me was
We hope.
really helping, because
I think it did.
I don't
I
get
absolutely
colds,
do.
and I never felt like I was susceptible. Of course, everybody's susceptible to COVID,
yeah,
but
I mean, look,
I felt protected. Is
right.
really what
and
I'm saying.
I think really it all depends. I mean, when you have a bad GI tract, like the young woman who called about her granddaughter, when you have inflammation in the GI tract, you can't possibly ingest that many vitamins.
All right, we have a few minutes left of the show, and still time to take your calls at 855-839-1210. But I know, Dr. Molly, you wanted to talk about this, a young man who has recently returned
Oh, yes.
with colorectal cancer.
Right,
it's
and he had colorectal cancer prior to this. He came back. He just recently came back because he said he had finished up one course, and during the course, he was my patient. So he said he really sailed through the course of the chemo. He said he felt so good that he stopped coming. And it's interesting because he bought a particular series or a particular protocol, and he had one left. And I tried to call him a few times, but I'm one of these people that I'm not going to bother a patient. You know how I am, John.
Yeah.
I'm going to call you to show you that I'm interested, but I'm not going to beat you over the head to come back. This isn't like they used to do when they'd pull you in for men's suits. I don't.
That was the old South Street
That's
trick,
right.
remember?
That's right. So that's where I come from, so I know about
exactly.
it, right? But that's not for me. I'm here to give you, I believe knowledge changes outcome. So I'm here to give knowledge to patients and to help them, maintain their quality of life regardless of what path they choose when they have cancer. So he just coming back, and he came to me, and it was so nice. He brought his wife this time, and he said, I want to tell you something, Dr. Molly. I felt the best when I was coming to you. And I said, Joe, I'm so happy you're back. We started him. He finished up the one particular IV that he had left. And I said, listen, when you come back this week, I want a full blood panel. I want to see where you're at. I want to know what's going on, and we're going to request your records. So we're going to review all these and see what changes are necessary to get him through this second set of chemotherapeutics. So that's where we're at, John.
Okay, let's see if we can get one more call in. Joe is in Mount Airy. Joe, good morning. You're on with Dr. Molly.
Hi, Joe.
Good morning, Dr. Molly and John. It's good talking to both of you. I have an excellent show. I listen faithfully every week.
Thank you,
God
Joe.
bless you.
Thank
God
you.
bless you,
You're
man.
welcome. I just want to say real quick, like you said, Dr. Molly, for people who have to take, over-the-counter or prescribed medicine,
Right.
From pharmaceuticals, if they have to take it, so be it. But I'm like you and John. I'm very reluctant to take, over-the-counter pharmaceuticals. I believe in natural, more or less holistic remedies. But what get me, Dr. Molly and Johnny, you went to the commercial when they pushing certain drugs for certain.
Oh, my
It
God,
seems to
yeah.
me that a lot of times the side effects is worse than the disease itself.
You better believe it.
You ever notice how they start over things? They'll say stuff like, well, if you take this medication, whatever, if the side effects are violent
Yeah.
and nausea and possible death. And they say, they skip over the death part like it's something small or possible death. I'll be like, saying,
You know what?
Scary.
It's not small to us, right? No,
exactly.
I'm with you. 100%.
That's all I want to say, Doctor. I know y'all.
God bless you.
I love y'all show. And one of these
thank
days,
you.
Dr. Bob, I'm gonna get over there and see you and John.
You
one
know
of these days.
you're.
We'll get
You
over
know
there.
what, Joe? You're going to be more than welcome to come on over and see us because you got the right philosophy. And I'm telling you, That is a very interesting thing because
Yes.
that's what I believe.
How often have we talked about
We
that?
talk about it all the time.
the
and
disclaimer.
in the clinic, right,
Yeah.
in the facility, what
Yeah.
are they always talking about?
right.
Oh, he tried to put me on this, and I read it. Are they crazy? And then I came and talked to Dr. Molly's doc, and he said cut it into quarters. I mean, it's like, we want you to take, look, if you need a drug, look, guys, we're not going to be crazy. You need a drug, my goodness, you get it. If you're down with COVID and they put you in and they're going to give you the antibody, please, for the love of God, take it. But you know what? Let's keep you out of that hospital. This man is right. Let's try to keep our immune system up. And remember, God's ingredients, folks.
That's
He gave
right.
us everything.
You know,
we-
it's interesting because what he was just talking about, we talk about, but the disclaimer, the commercial is 15 seconds.
Yeah.
The disclaimer is longer than the commercial.
Right.
Because they have to get every possible thing in. Well, it could cause,
It
might
might.
cause, it could cause, it might. Could and might are the two words they love.
Yeah, yeah.
You know,
And
but,
very, very small side effects. Nothing to worry about. Just death.
but Joe, thanks again for
Thank
the
you,
call.
sir.
And special treatment for people from Mount Airy
Amen.
at Innovative Medical Associates. All right.
Amen. Amen.
Before we leave you, I want to remind you that if you missed any of today's show, you can hear it again this afternoon from 4 until 5. That's the Health Watch replay every Sunday, 4 until 5. Also, check out Amazon and check out the Barnes & Noble. Dr. Molly's new book is out, God's Ingredients 2. That's T-O-O. More of her fascinating stories about what
Patience.
has happened.
Patience. We have so many patients.
25 years now, going on 26, right?
Right.
Okay.
October.
Right.
It's hard to believe,
Hard
John.
to believe. That is going to put the wraps on another edition of Health Watch. And don't forget, we're here every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. I mentioned the repeat play, 4 until 5 this afternoon. And also the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, fabulous Fran, get well soon, Joanne, delightful Dee, Barbara, and our nurses Jess and Crystal, I'm your host, John DeMasi. Always a pleasure. Thanks for listening. Have yourself a great week and a healthy one. We'll do it all over again next Sunday. Health Watch, 8 till 9, Talk Radio 1210, WPHT. You take care.